Hello, and welcome to Think Local First here on Santa Cruz Voice. I'm really excited today by my guest, Dr. Rob Adams, with Back on Track Cranial Center, which is located up in Scotts Valley. Hi, Rob.
Hi, how are you?
I'm good, and welcome to our show.
Thanks for having me.
Yeah, so tell me, you're a Santa Cruz County born and bred. Tell me a little bit about your background.
Yeah, so I grew up in Scotts Valley, mostly. Kindergarten through 8th grade at Baymont, and then Scotts Valley High School, Cabrillo, and then off to chiropractic college, and came back right after. So I can't seem to stay away.
So what made you think you wanted to, or made you want to go into chiropractic?
Kind of a lifelong story there. My grandmother was a massage therapist for many years, and her father actually was a big proponent of chiropractic even back in the 40s and 50s before it was, I guess, such a popular thing as it is now. And then my mother is a nutritionist, and so just kind of, I guess, alternative healthcare, natural, holistic healthcare has always kind of run through the blood there. But I like to work with my hands. I like to be very hands-on, and so that's kind of how that started.
And you got out of college, and did you immediately start your business here in Scotts Valley?
I did. Yeah, that wasn't initially my plan, but life, I guess, kind of forced me into that. I wanted to work somewhere else, kind of get my feet wet, but instead I got thrown into the deep end, and I was able to swim. So.
What was that like? I mean, to start a business from scratch when you're fresh out of school?
Terrifying.
I bet.
Yeah, you've got all these student loans, you used to have money coming in, and now it's no longer coming in, and in fact, they want it back. So having to start from nothing, build up a patient base, and pay all your bills, yeah, it was absolutely terrifying. But I opened up inside because my grandmother actually passed away very shortly after I graduated, which is sad, but also the timing couldn't have been better. There was a room open in where she used to practice, and so she went out and I went in, and the rest is history.
So tell me, how long did it take to kind of build the practice to where you have it today? I mean, it seems like you guys you're pretty busy.
Yeah, and it's still building. I don't think I've reached my maximum potential yet as far as visits go during the week, but I'm definitely in a much better place every year. Mm-hmm. So it took about 3 to 5 years to feel comfortable that I wasn't going to go out of business.
Story for all businesses.
Yeah. And kind of after that 5-year mark, things really started snowballing, and it's only gotten more as time goes on. You just being in one place for so long, eventually word spreads, and you start seeing families. It starts with one person, then the next, and then the kids, and then...
So your practice is based on the sacro-occipital technique.
Yes.
That's the primary thing that you do?
That's right.
So tell me, what is that?
So it is a method of chiropractic that involves traditional chiropractic and osteopathy. It was developed by a doctor who was both an osteopath and a chiropractor and an engineer, and he decided that each practice left something to be desired, so he kind of filled in the cracks using both of them and came up with the full body approach. And so once I started learning about that, I realized that this is going to be it for me. It makes sense. Everything's very intuitive, and the results that I'm seeing with my patients, really spoke for themselves.
Filled in the cracks, no pun intended.
Exactly.
I think that's what a lot of people think of chiropractic as being going in and getting your back cracked.
Right.
And it's so much more than that.
It can be, yes. And so that's what I like to bring to the table there.
Now, is this a technique you learned at Palmer, or?
It was one I was exposed to at Palmer. It wasn't an exclusive class that they taught, but they have electives, so you can take, activator, which is that little clicky gun thing. SOT was an option. There were several other different Gonstead, many different techniques that we were exposed to. But SOT I really took to like a dog to water, so it made the most sense to me, and the more I read about it, the more I decided it was going to be how I would practice.
And SOT stands for that sacro-occipital technique.
Correct. So that the occiput being the base of your skull, the sacrum being the bone at the bottom of the spine, and then the tissue that connects those two, which is very, very strong and also houses the brain and spinal cord and keeps all the cerebrospinal fluid moving. So getting that balanced kind of takes precedence over everything else in the entire body.
So as a potential patient, I mean, what are the things that I could be, suffering from that the SOT method or technique would take care of?
I would say it's just the same as any other chiropractic problem that someone might be having, spinal pain, headaches, low back pain, just your typical things. I just like how and even muscular problems too. I just like how this technique kind of puts a holistic approach. I'm not just moving certain bones, we're balancing the entire body and getting the immune system to function better and all those other little things that the nerves control, because the nerves control everything in the entire body.
So how long has that particular technique been around, would you say?
I believe the initial development of it was in the 1920s. The final writings of Dr. Desjarnet, who's the creator of it, I believe 1984 was his final publication. So it's been around for sure, but it's not as common as other types of chiropractic, and mostly I think because it takes a little bit more time, and so that translates to dollars essentially. So more time means less patients, and kind of that model.
I know. I think back on chiropractic care that I've had in the past, and it could be just a 15-minute visit. And what you do on not the first visit necessarily, but on follow-up visits, it's a 30-minute full
correct
treatment. And then your initial visit, is that longer than that?
Yeah, so the initial visit is an hour and a half, half an hour for the treatment, and then the exam takes about an hour, because I sit down and we go through your entire medical history, the history of the complaint, lots of different testing the muscles, the nerves, the joints, really identifying what's going on there, so that way we can have the more effective treatment.
So how would you say chiropractic treatment has maybe evolved over the years? I mean, I know that coming to you is different than I've had experience at other chiropractors, but I don't know if that's because you're a younger, newer chiropractor, or just different techniques that you practice, or how has it evolved since its inception, maybe?
Well, I would say there's a lot more what people would call sports chiropractic, so a lot more extremities, arms and legs, a lot more muscular work. Like the traditional chiropractic is just, you've got a spine, you've got bones in it, we're going to move those bones around, which has been effective. But then there's more to the body than just the spine, so I think that's kind of how the profession has evolved to treat more than just the spine.
Now, your particular practice does more than just the SOT technique, according to your website, at least.
Yeah.
What are some of the other types of treatment could I expect if I came in?
That's a good question.
Well, according to your website, there's a cranial manipulation and...
Yes, so that's all kind of part of SOT. It's a separate sect of it, the cranial manipulation that can be... I guess that would be more osteopathic in some regards. Let's see I think soft tissue I have on there. So I do Graston technique, which is basically Chinese gua sha, where there's a tool that's scraping the tissues to get any scar tissue to loosen up. Rock tape, I do that. So kinesio tape.
So I might come in, for example, if I had a sports injury of some kind.
Right.
Yeah.
Yeah. So if you've got a knee, perhaps a swollen knee, you twisted it, we check to make sure there's no structural issues that require surgery, and then we could go about adjusting if needed, and then some muscle work, and then maybe some taping on top of that.
So is all of that of your designing a particular program for a patient, I mean, how does that all come out of that initial, because you talk very specifically about having individualized treatment program. It's not like, this is the program everybody's on.
Exactly. So what I do with each person might be the same as someone else, but it's all, I would say it's most of the time different. So because people have different needs, people have different healing times, different complicating factors. Some people have a lot of maybe tightness or tension. Some people might have muscle weakness. So it really depends on the patient, how we go to, plan a treatment.
I'm going to do a time check here because my phone just is...
You're 10. You're open all 11.
Okay, almost 12. I know that you mentioned that a lot of times that you end up with a whole family. So
yes,
the treatment, for example, on my granddaughter, who is a ballerina, is different than what you would do on me, and the difference between myself and Tam might be different.
Exactly.
So how much do you see children in that situation? Is that common, or?
Yes, yeah. Especially young active people, they tend to have, either growth type of issues. Maybe one leg is growing longer than the other, and it causes their pelvis to tilt, and then that goes into the spine. Or if they're very active, such as a dancer, they're on their toes a lot, so ankles and knees are a thing. So it really, there's very specific, people have specific issues for whatever they do in their life. So we want to address those.
Now, I also know that some people are resistant, to chiropractic care.
Yeah.
And what I'd like to do when we come back from the break is talk a little bit more about, why people are resistant, why, within some circles that chiropractic care may have gotten a bad rap.
Sure.
So let's go ahead and take a break. This is Susan O'Connor-Frazier here on Santa Cruz Voice and Think Local First, and we'll be back after some messages from our sponsors.
Shen Yun Performing Arts is back. This season, take an incredible journey through 5,000 years of culture with Shen Yun. Discover why people everywhere are giving Shen Yun glowing reviews.
I have traveled all over the world to 50 countries now, and I have never seen a production any better than this anywhere.
5-star.
I'm blown away. It's blown away my expectations.
Shen Yun is an experience like you've never had before.
Startling and breathtaking. We haven't had quite an experience like that in all the years that I've lived here, so it was special for us.
I think that I learned more in this performance than I actually do in a whole week of school.
Experience the beauty and energy of classical Chinese dance with Shen Yun.
Was more breathtaking, more heart-wrenchingly beautiful, more amazing than I had expected. You just have to come see it.
Coming to San Francisco, San Jose, and Berkeley, December 29th through January 14th. Shenyun.com/CA.
What's your family eating for dinner? Chef Ben here at the Back 9 Grill and Bar, where you can pick up family dinner that feeds 4 to 6 hungry people. Family meals include a full rack of ribs, a whole smoked chicken, pound of pulled pork, and plenty of barbecue sauce. Served with a full quart of baked beans, coleslaw, macaroni and cheese, dinner rolls, pickles, a side of onions, and for dessert, brownies with a pint of Mary Ann's vanilla ice cream. Call and order your family's dinner about 15 minutes before you want to eat. See you at the 9.
You never get a second chance to make a good first impression. When you want to make a good first impression, start with Dynamic Press Angelo.
Dynamic Press can take care of every printing need, from business cards to stationery, apparel, mailings, brochures, everything but money.
When you want to make a good first impression, start with Dynamic Press in Santa Cruz.
479-7920. dynamicpress.com.
Welcome back. This is Susan O'Connor Fraser here on Santa Cruz Voice and Think Local First. And we're talking to Dr. Rob Adams, who is a chiropractor up here in Scotts Valley at Back on Track Cranial Center. And we were talking about resistance. Some people are a little resistant to chiropractic care.
Yep.
And why is that? What is it that you're aware of why people might be resistant?
Probably because just being resistant to manual manipulation in general, especially around the head and neck, people tend to be a little apprehensive, especially if there's a lot of tension around there, which kind of is the reason to go and get that sorted out. But there are many different ways to adjust the spine and not necessarily having to do what they call a high velocity, low amplitude thrust.
Okay.
Or
now
HVLA, that's, as we say in the industry.
What is that high? Say that again?
High velocity, low amplitude. Basically, it means a very fast but not very deep thrust. So that's kind of your typical chiropractic adjustment. That's what they call it.
Now, so how do let's say someone said, okay, you convinced me, I'm going to go. How do you, because you really need people to be able to relax.
Yes, and I actually have a number of patients that really do not like to be manipulated with those kind of thrusts. So I have an activator that I use regularly, and then part of SOT and another technique that I use for soft tissue called orthobionomy. Those, I can get the joints to move and the tissues around them to relax without having to do those thrusts.
When should I choose chiropractic care versus more the Western medicine care and go to an orthopedist, for example?
Yeah, so that's a good question. The more severe a trauma is, then you want to look at Western medicine, especially like a car accident or a very big fall. If maybe there's a broken bone, we always want to take a look with an x-ray or an MRI to make sure that if you decide for chiropractic, that would be a safe thing to do. But chiropractic is a good portal of entry. So if you go, I have some pain, or something just doesn't feel right, chiropractor is a good way to start, just because they'll do all these testings, they'll do soft tissue work, and it's a more conservative approach, I guess you could say. So if you are having any dysfunction or pain, I would say chiropractic should be the first option, unless it's something really severe. And because chiropractors are trained on referring to the proper medical professional, at least they should. If they see something that's out of their wheelhouse, they should send you to the proper place.
Yeah, I know that there also that there's people that choose to make chiropractic, a regular thing, where they're going every 2-3 weeks, or, whether they've necessarily experienced pain, look at it like a car tune-up,
Yeah, exactly. So kind of like a supportive care type of model. Because just in life, we tend to do repetitive movements, or maybe we sit too much, or we do something that kind of causes our body to go into dysfunction. Even though there's not pain, we can still get things back on track before they become a problem.
And so what if you're looking at a patient, and what would that kind of regular, maintenance program look like? How often do you recommend, or is it different for everybody?
It's different for everyone. It's very individual. Some people, I see them, I have some people who need to come every week, so they say. And then others once a month, others maybe just a couple times a year. But I do think it's a good thing just to kind of get, like you said, a tune-up, kind of as you would go to a dentist, get a cleaning twice a year, and have the dentist check things out once a year, just kind of the same way for general spinal hygiene is what they used to call that.
And is it good to combine chiropractic with other kind of body work like massage and stuff?
Yeah,
things
absolutely.
Like that?
Yeah, soft tissue work like massage, acupuncture. Some people like rolfing. It's a little bit heavy-handed for me, but people like what they like.
Yeah.
But I do think it's good to combine it with other methods of body work.
I know that some people in the past that were kind of in my circle of friends would say, well, it's the chiropractor felt like there was some element of that they had to go once a week, whether they felt like they needed to or not, and that they kind of felt like a little bit of pressure in coming more often.
And I think that's another form of resistance, that people don't want to go see a chiropractor because they have been told through other people they know, or they just assume that chiropractors are going to want you in there every week until your insurance money runs out. So, and that is how some chiropractors run their business. And so that's definitely another point of resistance right there.
I've experienced that kind of program type of chiropractor that did that, and I was resistant to that kind of program. It's like, I want to go when I want to go.
Yeah.
And that has worked fine for me. Thinking about other types of care that you provide in your office, I noticed that there's also potential for nutritional counseling, and tell me about those other services.
Yeah, absolutely. So chiropractic is very well complemented also by nutrition. So your body functions better when it's getting adequate nutrition, either from food or from supplementation. There are certain building blocks that our bodies need to function properly, and so that's part of my examination, is assessing if maybe there's a deficiency in some of those nutrients, and that we can support that a little bit better. Because if we're lacking in certain nutrients, that can actually cause pain.
Interesting.
Or muscle cramps or something of that nature. Mostly it's dehydration. A lot of people tend to be chronically dehydrated.
Interesting. And then I noticed also that you had what they called foot levelers. Are those the same as orthotics?
Yep, those are a type of orthotic. So
Okay.
they're custom orthotics. I have what they call a kiosk. You basically stand on it, and it's a large laser that scans your foot. It assesses the pressure of each foot. Maybe one arch is collapsing more than the other. Maybe you put more weight on one side over the other. So it assesses all that, and then it makes custom orthotics for you.
And when do you decide that someone might be a candidate for that?
I usually definitely reserve that for people who have flat feet, like very fallen arches. Those are pretty much number one, or even high arches too. Because if you have excessively high arches when you're walking, and if the shoes are not supporting that high arch, then it's going to be kind of stretching and flattening out, which can cause pain and plantar fasciitis. So too much arch or too little, I would definitely recommend those. People that have a lot of pain in their feet or their ankles and knees, we might have to go that route. But generally, I start with just my hands-on treatments, get the body balanced, and then we see how things go from there.
Now, in the course of your treatment, would at some point you might recommend acupuncture or massage or some other type of treatment to be done concurrently?
Yes. So I do, part of my assessment and part of SOT is organ work. So we check. So one of the things that I check each visit is to see, if we're seeing any reflexes for any of the organs that might need help. In which case, I would recommend acupuncture for them. And massage is just always a good thing to do for mental and physical relaxation.
I agree. Definitely, I'm on that massage bandwagon. And one of the things I've learned over the years is that oftentimes the place where you feel the pain is not where the issue is.
Right.
And I had chronic pain in my right leg, right below my knee, and it wasn't until I finally got an accurate read to my MRI, which took a couple of years to get that did we discover where the issue was, which was in my lower back.
Right.
And so, I find that one of the interesting things is that you'll check my neck and then adjust some other part of my body because of that. So talk a little bit about that, about the physiology, I guess, of that.
Yeah, so the body's connected. Everything is connected, kinetic chains. There's a really great book called, what's it called? Body Trains or Fascial Trains. Shoot, I can't remember what it's called right now.
Of course.
But it shows all the connecting tissues, basically from the bottom of your foot all the way up to your neck.
We always know that, line of your foot bones connected to your ankle bone,
Exactly.
But it's more than just the bones.
Right. So all those tissues, there's really not a place, after studying cadavers in school, you see that there's really not a separation of one tissue to the next. They all just kind of blend into the next, which was very interesting and very cool.
Other than the cadaver work part of it.
The smell, maybe not so great, but the rest of it was great. But yeah, when I'm checking the neck to see what's going on in the low back, that's another SOT specific thing. They call it R and C factors, resistance and contraction. So basically, when there's something in your low back that's out, because we're looking at that tissue that connects the occiput and the sacrum, you'll find tension patterns along that entire tissue. So if there's something in the low back that has gone out of place, we can check the neck to see exactly what has happened, and then we go back down to the low back, put the correction in, recheck the neck, and see if that's satisfied.
And one of the things that you do is, I think it's about traction, where you're putting in these little wedges and, but they don't stay in that long so it's like, well, what could this possibly be doing? And,
right.
That's kind of the question that's going through my head is what's the purpose of some of that kind of adjustments?
Yeah, so those wedges are called SOT blocks. That's another SOT hallmark thing, like the activator has the instrument, SOT has the blocks. What I'm doing with those is basically leveling your pelvis. We assess to see if maybe there's a twist or some torsion or even separation between the sacrum and the ilium. So when we put those blocks in there, what we're doing is taking the torsion out, balancing the pelvis, and then allowing the joint to approximate. And depending on which category you're in, that would require blocking at different areas of the body, face up or face down, and then for different times.
Now, does the block actually make the difference, or does the block allow you to make an adjustment that is what makes the difference?
The block is the adjustment. So it's gravity. So particularly, I guess, if I can speak to your case.
You can speak to my case. I've told the world everything by now.
Yeah. So what you have is called category 2, where there's a separation of the sacroiliac joints from a loose ligament, either from a repetitive motion or an injury. I mean, if you've had children, your pelvis has exploded, so it's kind of, we're probably going to see that. So in your case, we have you on your back, and then we put the blocks in, one up high and one down low at different angles to get the pelvis to bring the short leg longer and the long leg shorter, and also allow the sacrum with gravity to drop back into its place.
That just sounds so complicated.
It's a complicated concept, but in practice, it's pretty simple. So that's another reason why I like the technique.
I know that coming out of a session with you that, I feel so much better, and that you've a lot of times found things that I didn't even know I had.
Yeah.
And how often does that happen? Is that kind of like, wow, I didn't even know that hurt?
That's pretty much all the time.
Yeah.
Because I'm checking the whole body each time, because it's such a dynamic thing that even just during treatment, I might check something, and then once we start the treatment, I go back and check it and it's gone, because it was compensating from something else, like a tight psoas muscle or a tight hip or hamstring, whatever it might be. So, we check everything, make sure that we're getting the whole body balanced, and it's amazing what'll clear up that you didn't even know was bothering you until you go, you know what? I haven't gone to the bathroom in 3 days, and right after our treatment, I went home and went. So
interesting.
Yeah.
So the things that you're adjusting could affect something like digestion.
Absolutely.
Okay. And in the course of the treatment, some of the, I know that, again, we're using the actuator, we're, and finding things that I didn't know even hurt. But for the most part, what I do walk out with is whatever I came in with is resolved. And is that a pretty normal thing, or does it usually require multiple treatments before they have that? Thank you, Dr. Rob. You're a magician.
Yeah, I wish I was a magician. Sometimes we have what we call the chiropractic miracle adjustment, where you come in, you've got this severe problem, and then with one treatment, it's 100% better and it stays gone. That it doesn't happen very often. I think it's maybe happened 5 times ever that I've experienced. But in general, they feel much better when they leave, and then over the course of X amount of time, things kind of start creeping back, and so that's when we want to time the treatments so that we're kind of catching it before it creeps back, and then we can push the treatments out further and further and allow the person to function better without being in pain.
Okay, well, we are coming up on our second break here, and we are going to come back with Dr. Rob Adams from Back on Track Cranial Center up in Scotts Valley. This is Susan O'Connor Frazier with Think Local First, here on Santa Cruz Voice. Don't go away.
Time to eat and watch football. Chef Ben here from the Back Nine Grill and Bar at the Pasatiempo exit. Every football game, every Sunday, starting at 10 a.m. We have dollar wings, a breakfast sandwich, and beverage specials. Monday and Thursday night football as well. College ball all day Saturday. Other sports? Oh yeah, time to eat and watch football. Take the easy off Pasatiempo exit from 17. See you at the 9.
Shenyun Performing Arts is back with a brand new production. For over a decade, Shenyun has performed around the world to sold-out theaters and inspired millions. Coming to San Francisco, San Jose, and Berkeley, December 29th through January 14th. Tickets at shenyun.com. That's SHENYUN.com. Or call 888-633-6999.
Greece is cheap.
But the airfare costs a fortune.
Paris?
Not much closer, and again, airfare...
What about Puerto Vallarta?
Let's face it, flying anywhere is just too expensive.
Wait, what's this? Low-cost airlines.
With one call to low-cost airlines, you'll drastically slash your travel costs. We're talking insanely low airline prices to any of your favorite destinations. Where would you like to go? London, Rome, Costa Rica, Australia?
Wow, that's cheap.
So why wait? Call now to learn how crazy cheap it is to fly anywhere in the U.S. or international. Our prices are so low, we can't publish them. The only way to get them is to call to instantly hear the most amazing best deals on airline travel. It's that easy. So call now and start packing.
800-704-1662. 800-704-1662. 800-704-1662. That's 800-704-1662.
And welcome back. This is Susan O'Connor Fraser here with Think Local First on Santa Cruz Voice. And I am here with Dr. Rob Adams. We just call him Dr. Rob, from Back on Track Cranial Center in Scotts Valley. And one of the things I know that that Tam has is sciatica.
Mm-hmm.
Explain what that is and how you treat that.
Yeah, so sciatica is basically just irritation of the sciatic nerve, which stems from the low back and upper sacrum. So there's, I believe it's 5 different areas, so from L4 all the way to S3, and it creates a very big nerve that runs down the back of the leg, kind of through the hamstring and calf, and goes all the way to the foot. So when people have really hot burning pain in the back of the leg all the way down to the foot, that's a classic sciatica right there. And sometimes most of the time that's caused from a herniated or a bulging disc in the low back from at one of those levels. It can also be what most people call sciatica tends to not actually be true sciatica. Like they might have pain down the front of their thigh or the side. And that might be coming from the sacroiliac joint, not necessarily from the lumbar spine. So we want to identify properly what's going on there, and then we can properly treat it. So proper adjustments to the right segments, and then getting the pelvis balanced, and sometimes even muscles too. There's a muscle in kind of deep in the glutes called the piriformis, and that if that's really tight, it can actually put pressure on the sciatic nerve and cause that same sciatic pain.
And one of the things I also found interesting about your treatments is we talked a little bit about, soft tissue and the adjustment that you do or around the psoas, which people may not even know most people probably don't know what the psoas is. And it starts with a P.
It does.
It's one of those words that's like, what? It starts with a P.
Yeah, so the psoas is the hip flexor. So it's able to it allows us to bring our knee up toward our chest. And it's also very involved in running. And it tends to be, if we're stressed out a lot, it's a fight or flight response. And so that muscle gets tight and it's ready for you to run. But we don't run when we're stressed anymore. We just sit there and deal with it. And so over time, that muscle can be chronically tight, which it can actually pull the lumbar spine out of alignment because the psoas attaches to all 5 of the lumbar vertebra and the discs directly. So a chronically tight psoas can actually pull your discs out.
So how do you deal with that?
Well, there's a few different ways to get in there, and you can do it by stretching. You can stretch your hip flexor, stretch the psoas, but in the office what I do is manually loosen it with a few different methods. And that tends to work really well.
One of the other things that I've experienced is that you work on my diaphragm.
Yes.
Which is like, I've never had that happen with any other chiropractor before, is having my diaphragm adjusted. Why are you working on that area?
Well, the psoas and the diaphragm share an attachment on the spine directly. So if the rib cage isn't quite moving as well as it should, it's the same stress response. So the psoas gets tight, the diaphragm gets tight. It's in a state where we're ready to run and breathe heavy. And when we breathe heavy, we use the muscles of the low back and the neck to pull the ribs apart rather than the diaphragm. And when we're at rest, the diaphragm should be the only thing that we're breathing with. So when we get into that dysfunction and kind of turn the table on its head there, we have issues with the psoas and the diaphragm, so oftentimes they go together.
It seems like there's also a lot of, you were talking about breath, diaphragm, breathing in the diaphragm. It seems like there is, a chunk of breath work that's happening during our sessions.
Yeah.
It's where you either have me do deep breaths, and in and out, or deep breath and hold.
Mm-hmm.
Why all that?
Well, that's by design. At the very least, you're in my office for half an hour breathing with your diaphragm, so you're bound to feel better after that. So that's kind of my secret recipe.
You just gave it away.
Giving away my secret.
The talk about the head adjustments is,
Yeah.
not one of my favorite parts of the treatment, but it definitely, I walk out just kind of feeling more open.
Exactly.
In my skull after you've done some different work up there.
Yeah, so the cranium, the skull and face, they're actually made up of 22 bones. And so they all articulate with each other. They're not fused. They have very small, minute little movements between them. And because living bone is actually a little bit flexible, we can move and change the shape of the skull. So the manipulations, sometimes we go inside of the mouth and push in the roof of the mouth and underneath the cheekbone, and that's where the discomfort usually happens.
Yes, that's where.
We can also do things from the outside depending on what the patient's presenting with at that particular time.
Years ago, we had a masseuse that held my kind of these bones or something, and it almost put me in a hallucinatory state. And I was like, Tam could talk about that too. It's like we felt like we were, because she was up in Felton and in the forest, and you kind of felt like you were at one with the natives that lived up there. What was that? What is that?
So that's probably someone who's trained in craniosacral work. So sacral, occipital, cranial, sacral, they go hand in hand there. But what she was probably doing was balancing your cerebrospinal fluid from where you were pointing. That would be your sphenoid bone, which is what we generally call the temples.
Right.
So the way the cerebrospinal fluid moves within the brain and spinal canal is very specific. And so if there's an issue within the cranium that's blocking or hindering some of that flow to a certain area, then different muscles in the body will tighten up. And that's why I do the cranial work. So if let's say if it's your temporal bone, for example, which is the bone around your ear, then it'll cause, if that bone is dysfunctional, then it'll cause the low back muscles on that same side to tighten up.
I'm sorry, but that's crazy.
Yeah, it is. And then if it's the occipital bone, so the base of the skull, then it'll cause your glute muscles to be tight there. And if it's the frontal bone, the forehead, then it'll cause your hamstrings or calves to be tight on that same side. So the whole thing is about cerebrospinal fluid movement and making sure the brain has its nutrients, because the brain is of utmost importance in the body. And so if it's not happy, everything else is going to suffer. So it'll contort the body in all different ways to make sure that it's getting what it needs. And so that's where I come in to I read the map the body's put out there and go, okay, so we want to be here, and then we can move toward that balance.
So have you ever experienced or encountered someone that you just can't figure out what's going on?
Yes, there are some difficult people, usually ones that have surgical fusions within their spine or scoliosis. That one tends to be pretty complicated, or a lot of dental surgeries or different things like that. Those tend to be my slow to non-responsive people.
Now, one of the people that you treat in our family is a former Derby girl, and has, experienced a lot of trauma in her body, and yet here, I don't know how many, at least 5 years or more post being an active skater, she's still experiencing stuff. Is that something common where you've got these, athletes that are experiencing issues today from maybe something they did 10, 20, whatever years ago?
Yeah, absolutely. Yeah, there's a lot of things, especially in contact sports, where things might creep up over time or they're very slow to change. And then some people have relaxed or loose ligaments, especially around the pelvis, which causes things to fall out very quickly. And then the whole compensating pattern comes right back in. So then we have to think about something like a sacroiliac belt to support those ligaments while the body is able to heal. So it's not just pulling at it over and over and over.
And then when someone's kind of going through that, do they start out potentially with more frequent visits and then over time can go into less frequent visits? Is that pretty common?
That's exactly. exactly how I do it.
And do you find that you're sometimes also seeing a patient who is going to a Western medical doctor as well as you at the same time? Is that common?
Usually they'll start with medical if there's an injury, let's say. So maybe there was a car accident or a trauma of some sort. They went to the Western medicine, went to a medical doctor, got assessed just to make sure, there wasn't any serious problem. And then they come and see me. But usually, as far as working together, it's sometimes it's really hard to get a hold of them. I'd like it to be a little bit more cooperative than it currently is, but it does take a lot of effort to get people working together.
Now, I know that one of the things that seems to be more of a more recent development in the insurance industry is, and maybe it's not that recent, is covering more of these alternative approaches, is that there are insurance programs that do offer chiropractic care or, acupuncture and, as far as treatment and some amount of coverage. How do you handle people that have insurance and would like to use that?
Yeah, so I'm not in network with any insurance companies because I do a lot of things that aren't covered. So what I do is I provide my patients with super bills that they can use for reimbursement from their policies.
Okay. Yeah, I know that I'm on Kaiser, and it actually has some people that do treatment, but I'm not going to leave you. So, one of the things that I saw on your website was, and I don't know how often you do this, is a dermagrid scan. What is that?
Dermagrid scan. I might need to update my website.
Okay, we'll take that. We'll edit that part out, Tam. So, what other elements of the whole, of looking at the kind of the whole patient and wellness, are the things that are part that you kind of look at as critical to your practice and for patients? I mean, is that you talked about nutrition being one of those things, and maybe, doing a foot leveler as being another part of it. Are there other things that come into that?
Yeah, so giving, specific stretches or exercises for home care type of things just to support what we're doing and make sure that bringing the body back into balance. I see a lot of people that have what we call upper crossed posture, or tech neck, as some people call it, with the forward slumped shoulders.
Looking at my telephone.
Exactly.
Scrolling on Candy Crush.
Yes. So there's different stretches that we can do and strengthening exercises to kind of reverse that pattern. And that's very common. Also, for the lower cross, we have people that tend to tip their pelvis forward or overarch their back just when standing. And that can lead to tight muscles of the low back, which can lead to pain. So we want to make sure we're engaging the abs properly and working on exercises to get those functioning.
Now, I know that one of the things early on, because I was also working with a personal trainer, you put together an exercise program for me, which I shared with my personal trainer, but part of it was like no yoga or Pilates or something that at least at that point of where I was in my treatment plan.
Yeah, so that's part of the hyperflexible ligaments of the sacrum, the SI ligaments. So when those are overstretched, what we want to do is support them to shorten. So stretching the low back, stretching the pelvis will just kind of re-aggravate the problem until we get them healed.
Because that would be like one of my favorite things is hanging, you know, and stretching that lower back. There was felt like a lot of satisfaction, and you go, no, don't do that.
Yeah, yeah. So what happens when that ligament is stretched and basically the joint is open more than it should be, then inflammation is allowed to get in there, and so when we close it down, it might compress that inflammation, and it might feel like you want to stretch it open again, even though it's kind of reversing what we've done. So icing, walking, those are all things to get inflammation out and retrain those ligaments to go back to their original size.
Yeah, I think you recommended, walking versus climbing or something like that.
Right.
And then there was a treatment, something about ice versus heat.
Yes.
And I don't think a lot of people know, when they should use which one.
Right. So heat is very good for muscles. Ice is very good for joints and ligaments. Muscles are able to stretch and return to their original size very elastically. And ligaments, it's kind of like a plastic bag. When you stretch it, it kind of stays stretched. It will eventually shorten, but it takes a long time and a lot of effort making sure that we're not re-aggravating whatever it is. So when it comes to those sacroiliac ligaments, because they're constantly under stress, because they're weight-bearing, we have to be extra careful.
Is there anybody that couldn't benefit from some amount of, chiropractic treatment? I mean, or is it like the dentist, which probably I shouldn't use that example, but you should go, that just about everybody could benefit from a semi-annual, visit to a chiropractor like you?
Yeah, I can't think of anyone that wouldn't have some sort of benefit.
I mean, for if nothing else, because our bodies were developed for, to be one thing,
Exactly.
Hundreds of years ago when we all had to, we were all hunter-gatherers or whatever.
Right.
To where we are today, where we're a good chunk of us are sitting at a computer for too long.
Yeah, and some people even theorize that the invention of the toilet really screwed us up.
Oh, really? Interesting.
Because we used to squat.
Yes.
And I mean, there's still cultures around the world where they squat primarily all the time.
Right.
So if they're not standing and walking, they're in a full squat, and they tend to have much less back pain than we do.
Interesting.
Yeah.
I mean, I've been in those restrooms in parts of Asia.
Yeah.
And you're like, what am I supposed to do here? I don't think so. That's squatty potty, yes. So if I'm interested in learning more about you or coming in, I mean, what is that process for, coming in for an evaluation? How do I get in contact with you?
Yeah, the best way is to call the office. Should I say the number?
Sure.
Okay. Yeah, it's 831-440-7787. You'll get me. You'll talk to me, and then we'll kind of go through maybe a few minutes over the phone just to see if it's a good fit, see what's going on, and then the real magic happens when you come in. We check out all the test your body, check out what's going on there, take your history, see how your body's presenting, and then we can go from there.
And that phone number again was?
831-440-7787.
And tell me about what's your website, because some people wanted to look around before they call.
Yeah, so my website is www.backontrackcranialcenter.com.
And what I also find very convenient is that once you've come in for that one first appointment, you also have an app that people can use to schedule their next one.
Exactly. Yeah, my charting and scheduling app you can sign up for the portal and basically put yourself. You can schedule your own visits online at your convenience. Just not the first one because it takes an hour and a half, and so it's a little bit more involved.
Okay, well, thanks so much for joining me today. Really appreciate it.
Yeah, thanks for having me.
And we're going to wrap up this hour of Think Local First programming here on Santa Cruz Voice. This has been Susan O'Connor Frazier. I definitely suggest that you check out Dr. Rob Adams at backontrackcranialcenter.com and give him a call for that first appointment. Thanks for listening today, and we will be back next week.